Richard, tell me about your centre and your job in it.
Okay, I'm a reader in epidemiology at Newcastle University. Primary interest is in the etiology and survival of childhood and young adult cancers. Particularly in Newcastle, we've got a specialist registry containing all cases of childhood malignancies in the northern England area back to 68.
Well, that's a great opportunity to study then. Why were you interested in Hodgkin's lymphoma?
Well, Hodgkin's lymphoma, a lot has been done about Hodgkin, but there's still no clear clues as to what the actual etiological reasons for its origins are. So I think there's more to be done to study Hodgkin lymphoma.
And you were looking for correlations. Can you tell me what exactly you did in the study?
Yes, we looked at correlations with age, sex and deprivation. By deprivation we used census measures of area-based socioeconomic deprivation, and including components of that, including things like unemployment, household overcrowding and housing tenure.
And what came out of your study?
Okay, the interesting findings were that we found a female excess for the young women aged 20 to 24 years over males, which is interesting because overall there's a male excess for Hodgkin lymphoma. We also found that for we were particularly interested in subtypes, that for the nodular sclerosing subtype there was a protective effect of deprivation. So that in the more deprived areas, there was actually decreased incidence. So that's a very interesting finding.
Now, I know that some of the cases of Hodgkin's lymphoma are still puzzling, but you've got some firm correlations now. Do you have any clues about the etiological factors?
Well, the interesting thing is that similar findings have been found for childhood leukemia, and the inference from our findings would be that maybe there's a similar reason to explain this protective effect for deprivation for this particular type of Hodgkin lymphoma. We would perhaps hypothesize that infections or infectious agents might confer protection against subsequent development of this subtype.
Now, is this the theory that a little bit of dirt does you good?
Yeah, exactly. It's the hygiene hypothesis, yes.
So that's why the overcrowding could be beneficial?
Potentially. We wouldn't obviously advocate parents making their children be exposed to lots of infections, because clearly infections themselves may not be potentially beneficial. Yes.
But then you importantly looked at young adults and not just children, yes. And you found this extremely interesting correlation of preponderance in women, young women, yes. Whereas in kids, it's boys are more preponderant. So what's the explanation etiologically for that, do you think?
Well, we think that there might be some modulation or influence of sex-related hormones to which might lead to the increase in young women.
So it seems to be pointing towards things like hormones and also infectious agents or the immunological response to them that could be controlling Hodgkin's disease. Does that sum it up?
For this particular subtype, clearly for the other subtypes there was no clear evidence, but for this subtype, yes, that's what we would conclude.
Well, clearly doctors have an important interest in advising their patients about a host of public health measures. What would you distill out of this for doctors? I
think that there's still further work to be done before clear messages can be given in terms of providing advice for patients. However, I think that this is the first step which indicates that both hormonal factors and factors related to infectious agents which need to be studied further.
Do you think there could be therapeutic targets in there at some time?
Potentially, if these findings are firmed up by further molecular studies, well, then potentially, yes.
Thank you very much indeed.
Thank you.